Hello, friends. Welcome to the local update from the Aspen Daily News. My name is Oliver Sharp. Very excited to be joined today by Dr. Catherine Bernard, Chief of Staff at Aspen Valley Hospital. Dr. Bernard, how are you this morning?
Great. Thanks for asking, Oliver. Happy to be here.
It's good to see you. Can you just tell me, give me an overview of where we stand right now as a county and as an incident management team in this battle against COVID-19?
Well, we're coming along, and the big thing is we have vaccines to be given, which is huge. We gave over 1,100 on the 14th and 15th of January, as everyone knows, and our second doses will be given to that population next week. Vaccinations are the way we're going to slow down this virus.
And this is such good news to our community, to actually getting vaccines into people's arms. Can you talk a little bit about how this vaccine actually works? Just break it down to a rudimentary level. What's going on when people actually get this vaccination in their arm?
So all vaccines really mimic an infection in the host. So when you get a vaccine, it tricks your body into thinking you've been infected with whatever that virus is, in this case, COVID. And then you mount an immune response. So when you actually see the virus later, hopefully you'll be able to contain it before you get terribly ill.
And a lot of different companies in the entire country have been working on vaccines. We hear about two different vaccines, the Moderna vaccine and the Pfizer vaccine. Any difference between those two? Should people worry about which one they're actually getting?
So the Moderna and the Pfizer vaccines are both really based on the same technology. The mRNA vaccines, they're called messenger RNA, is just put inside a lipid nanoparticle that helps it get into the cell and then give the cell instruction to make a protein that your body recognizes, specifically the spike protein, for both of these vaccines. So they work very similarly.
And as a healthcare worker and a frontline worker, you've been vaccinated. Any adverse effects that people should be worried about? You look great. So can we allay some fears that people might have of getting this vaccine that's pretty new to the market?
Sure. I do have personal experience. I received both doses of the Pfizer vaccine, and I'm almost 3 weeks out from that. I am showing some signs of IgG or immune response to that. So that's exciting. I had very minimal adverse effects, a sore arm, a little bit of headache. About half of our medical staff was vaccinated with the Moderna vaccine as well, and similar results from that group. Minor adverse events, mostly with the first dose. Some people had more significant adverse events, including myalgias or fevers with the second dose.
So definitely a good thing to go get this vaccine when you can. It's going to help you and help everybody in the community. One thing we are hearing about is some of these virus mutations, 4 variants now, I think I've read about. What does this mean for the general population and our health? And is the vaccine going to work against these variants?
Sure, it's a great question, and really everybody's talking about it right now. The preliminary evidence suggests certainly that the vaccines will work against the UK variant and hopefully also against the South African and Brazilian variants that we know of. But the big thing is that all viruses mutate when they're replicating, and that's how they get smarter. And we're really in a bit of a race with these mutations, and our vaccines, the mRNA vaccines available to us now, make our body react to the spike protein, and these mutations are in that spike protein. So, the key is to not let this virus replicate for a long time in people. That's where it's mutating. So if we can get as much vaccine into people and stop the virus from getting into people and replicating for long periods of time, we can beat it. We can beat it despite the mutations.
So vaccinations are the key here. You mentioned the vaccination effort that was spun up very quickly a few weekends ago and took great care of the people here in town. I understand that's happening again this weekend. Can you talk about the vaccination sites and that program that's going to go down this weekend?
Sure. So through the Benedict Music Tent site, where we vaccinated over 1,100 people in the middle of the month, this Friday, we will be vaccinating 200 people there. An email went out to people pre-registered in that group of 1B 70 plus patients. So we won't be able to do everybody there on Friday, but that will happen between the hours of 10 and 2. An email will be sent and an appointment will need to be made to get one of those 200 doses at that location. There is an additional location for Pitkin County residents this week being run by the Mountain Family Health Clinics. Appointments will be necessary for that location as well at the Basalt Middle School this Wednesday from 1:45 to 5 p.m. And appointments can be made through their Mountain Family Health Clinic phone number 970-945-2840.
Excellent news. Love hearing about more people getting this vaccine. But we have to remember that just because this vaccine is here, we're not out of the dark quite yet. What are we still asking people to do in their day-to-day lives to continue to combat this disease?
That's such a great point, Oliver. Thanks for bringing that up. The vaccine, despite the fact that Moderna and Pfizer are both reporting 90 to 95% efficacy, that still really means that 1 in 10 of people receiving the vaccine, or 19 of 20, say, does not have immunity. Also, we don't know that you can't get an infection that's asymptomatic with the vaccine. So we all are continuing at the hospital, and everyone who has been vaccinated should continue to wear masks, keep their distance, wash their hands, avoid indoor crowded spaces, all the things that we're already doing to prevent viral transmission. This is just one more layer of protection at this point.
Well, Dr. Bernard, thank you so much for being here. Thank you for all of your efforts at Aspen Valley Hospital and with the Pitkin County Incident Management Team. We certainly appreciate that. And thanks for the info as well for the new vaccinations that are coming out this weekend. Thanks again for being here.
Thank you for having me.
Thanks all of you for joining us here on the Aspen Local Update. You can find more information at theaspendailynews.com as well as on the social media networks. We'll see you tomorrow.